Health Minister Dr. Duane Sands said yesterday his ministry is organizing a volunteer force of medical personnel to give further aid to the devastated Caribbean country of Dominica. The Prime Minister has indicated that he would like the Bahamas to arrange medical assistance, and what we plan to do is to organize a team of volunteers, whether that is physicians, nurses, emergency medical technicians, etc., to travel to the affected areas to provide specific types of services, Sands told the Nassau Guardian yesterday. We don't anticipate that this is going to be an extended stint to provide aid to people who are at their lowest right now. Prime Minister Dr. Hubert Minnis, who led a delegation to the island Monday, visited with Dominican Prime Minister Roosevelt Skerrit and witnessed the destruction Hurricane Maria caused last month. During the visit, Minnis presented Skerrit with a $60,000 donation raised by the private sector and pledged to send medical professionals to the island. The medical facilities have been destroyed, Minnis said. I know that there were concerns with what we've offered before. There are still challenges with the medical fraternity and being a part of CARICOM. I've offered some assistance. I would meet with my Minister of Health and see how many physicians he can send to assist them. Medical services and care is greatly needed. When Hurricane Irma passed through the southeastern islands of the Bahamas last month, Ragged Island was devastated and deemed uninhabitable. At the time, Sands said health workers would not be stationed on Ragged Island. He said, it is difficult to put anybody on an island which is uninhabitable. It's one thing to say to a Marine of the Defense Force that you are going to live in a hut or cot, under a tent. It's a far cry different to say to typically a young woman, you are supposed to be providing healthcare services. How do you do that when you don't have basic sanitation, electricity, potable water, etc.? Some have questioned the decision to send medical personnel to Dominica and not Ragged Island. Sands explained that they are two different scenarios. I can point out that there is a distinct difference in a country that has been totally devastated and one community on one island, which while having being horribly devastated, there are resources within the country to assist, he said. I toured Ragged Island and was indeed heartbroken to see the devastation, but that is a far cry different when your entire country is wiped out. So one of the things that we have done is arrange for medical teams to travel in and out of Ragged Island to support the rebuilding and reconstruction efforts, but it is neither reasonable or safe to maintain full staff in Ragged Island. When you have a different situation where a country is landlocked, they have nowhere to go. They still require medical assistance, and so I don't think that those two things are in any way similar. This is a very, very different scenario. Sands said it is impossible to say how many people the ministry is seeking to gather, but he said the ministry has reached out to people who were previously involved in medical missionary programs to volunteer.